Let's talk about shoulder mobility today. When people talk about shoulder pain or shoulder mobility, they're looking at that big piece of meat right here called the deltoid. Well, in 15 years of doing soft tissue work on people, I have never once worked in the deltoid because the problem is not in the shoulder, it surrounds the shoulder. So when we're looking at shoulder mobility, we're not looking at the deltoid, rather we're looking at the 15 muscles that are crossing over the shoulder, keeping it in its socket. And here's the thing, when we look at the shoulder, it's not a true ball and socket joint. Really, it sits like my fist is sitting in my other hand right now. Okay, the labrum adds a little bit more depth to it, but it's highly unstable. Your hip, on the other hand, is a true ball and socket. So when we're looking at the shoulder, what we're really looking at is a softball sitting on a golf tee that has a piece of Scotch tape around the top of that golf tee. A stiff wind comes by, it's going to blow that softball right off the tee, no problem. Well, we have these 12 to 15 other muscles that are responsible for keeping that humerus in the socket. I'm going to show you how to release 5 of them today, the most 5 common ones that are going to cause pain and problems surrounding your shoulder. Part 1, when talking about shoulder mobility, we want to start off in and around the brachial plexus. It's a big area filled with nerves and blood vessels going underneath the collarbone, exiting and going down the arm into the shoulder, okay? When we have a tight chest or a tight pec minor, that is going to clamp down on that brachial plexus and create a whole bunch of problems going down the arm, specifically into the shoulder. How do we get rid of that? Well, the first way, get something, a chair, okay, that's about hip height. You're gonna get the Pso-Rite on top, and then all you're gonna do, take that peak and ever so gently get the peak into where your chest meets your shoulder. That is where your pec minor is. If you hit it just right, you may even send a little bit of pain into the shoulder or down the arm if there's some trouble in there. And we do that with the peak, using our body weight and then our breath to calm and relax us, telling the fascial nervous system everything's okay, getting it to release and relax. But really, number 1, it starts just by pushing this shoulder back into a good environment. Step number 2, now we are going to get into our subscapularis. Our subscapularis is a tricky little muscle that can hold a whole bunch of pain for the shoulder on the inside portion of your scapula, okay? The wing of your shoulder. As I lift up my arm, my subscapularis is going to be directly underneath my armpit, okay? Right in this area. So the way that we want to attack that, I'm sure you're guessing already. Once again, get a box or bench, something that's about hip height. We're going to get the Pso-Rite peak into there, and then we're just going to breathe and make sure it feels oh so good. A lot of times, if you have a really, really bad problem in this subscapularis muscle, you are going to get nervous pain down the arm. Your hand may even go to sleep, okay? This is not desirable, but it can happen. All you want to do is back off of that muscle, let that hand get some blood again, and then get back on it and start to pressurize that tissue to get the fascia to release in that area. Let gravity do its job. Let your body weight do its job. Let the peak do its job and just sink in to that subscapularis muscle, making it hurt oh so good. Step number 3, we are now looking at 2 small rotator cuff muscles, the teres minor and the teres major. These 2 guys are very, very small, but they're not insignificant. When they get tight, they can clamp down on your tricep, and also a lot of other nerves that are exiting into the shoulder, creating a lot of pain in the shoulder. So the way that we want to get rid of this one, we're looking at getting the peak into the area where our arm connects to our upper body. So same thing, we're going to place that peak right in that area and let gravity do its thing. We can lean in there nice and easily, breathe, keep the pressure in there 30 seconds, 45 seconds to a minute until that fascia decides to open up and relax. Getting that peak in there, opening it up. Step number 4, we are going to get into the biggest back muscle that we have, called our latissimus dorsi, or the lat for short. Our lat is very, very interesting. It connects to our shoulder, our spine, all the way from our neck down to your lower lumbar. It's a massive sheet of tissue. Unfortunately, it likes to get some trigger points up close to the scapula. So when these trigger points develop, they will push pain into the shoulder, and everybody wants to go and attack the shoulder. Okay, so how are we going to get rid of these trigger points in the lat? Well, we're going to take the Pso-Rite, we're going to lay on our side, and you guessed it, we're going to get that peak right into the lat, close to that shoulder blade. You can keep on searching around. Anything that's tight, tender, or reporting or sending a little bit of pain into the shoulder, that is your treasure chest, that is your jackpot, that's where you want to work. Okay, so from the shoulder, all around the shoulder blade, on down, probably as low as the middle portion of your ribs. Okay, that entire area can get stuck, the fascia can adhere to the bone, and then when you try to lift your arm up over your head, your shoulder hurts because it doesn't have enough space to operate. Step number 5, the end of the road here for our Pso-Rite shoulder mobility plan. We are going to use the Pso-Back, and we're going to get into another rotator cuff muscle called the infraspinatus. Why do we care about the infraspinatus? Well, it does a lot of eccentric and concentric, meaning lowering and raising action for the arm, especially for all you throwers out there, okay? Volleyball, baseball, even some basketball players, if you're throwing the long ball. We're gonna have problems in that infraspinatus, okay? So the reason why it starts to create problems with the shoulder is because it's stuck to the back part of the scapula and wraps around, connecting to the middle portion of the humerus. So when it gets tight, it wants to crank that arm and rotate it out to the side. When we want to do anything in front here, it's going to pull and it's going to create pain and problems. Using the Pso-Back, we're going to lay on our back, and all we want to do, get a little bit higher up, but we want to get that shoulder blade right on the Pso-Back. And from this position, keep moving around till you feel something tight, tender, or sore. And we just want to move the arm around too at the same time. This is mechanically, okay, and actively releasing the fascia surrounding that infraspinatus, all right? Helping it plump up, open up, draw water into the tissue, and now you stop getting that pulling sensation on the front part of your shoulder. If you do all 5 of these within the same session, I can guarantee you you're going to love how your shoulder feels. So there you have it, folks. 5 different exercises to hit the muscles surrounding the shoulder. I can guarantee you if you do all of these in the same session, you're gonna be walking around talking about how your shoulder is feeling so good.